morning, everyone. Welcome to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. We are very pleased today to welcome Dr. Daniele Behn-Smith, who's going to chat with us today about functional medicine and what that is and kind of how that impacts her practice. Before we begin, I would like to acknowledge that we are on the traditional, ancestral, unceded, and occupied territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So to everyone participating today, the topics we cover can sometimes be sensitive or emotionally triggering. If this topic is that for you, please feel free to engage in some self-care, talk to a friend, elder, counselor, or a family member, whoever it is that you need. Just make sure that you're engaging in those processes. Introductions. My name is Cole. I'm from the Chowthil First Nation, and I'll be facilitating the session today. Other Learning Circle team members in the room today but off camera are Cynthia, our production coordinator, and Jordan, our assistant coordinator. I'm not really going to, I know usually I introduce our speaker, but I'm not really going to do it because I think that Dr. Behn-Smith is just going to take care of that all herself. Just suffice it to say that, that she's a really wonderful woman, and I've known her for a couple years now, and I'm really excited to kind of dive into the conversation. So Dr. Behn-Smith, I'll hand it over to you.
Thank you, Cole. Thank you so much for the invitation to be here today, and thanks for starting us in such a good way. I also would like to acknowledge that I live, work, and play on the unceded territories of the Lekwungen and Tsimshian speaking peoples on what is now known as Southern Vancouver Island. I am calling in today from my office at the Southern FNHA offices on the unceded territories of the Tsayout First Nation, and I'm a very grateful uninvited visitor here. And my family ties are French-Canadian Métis to the Red River Valley. My maternal grandparents are the late Lucienne and Gédéon Zumen. My mom is Juliette. And I also have ties to Fort Nelson First Nation. I'm Etcho Dene. And my paternal grandparents are George Behn and the late Mary Behn. And my dad is Richard. I am, as Cole mentioned, a physician, a family physician who's gone through a few different phases in my career. And I'm here today to talk to you about something that I'm deeply passionate about, which is functional medicine. It is a funny term that doesn't, for me anyway, the first time that I heard that term functional medicine, it didn't really mean a whole lot to me, and I didn't know what it meant. But since I've become immersed in that type of practice, I've been absolutely amazed at how transformative it can be and how profoundly it can shift people's health and wellness. And I think that there's some aspects about the model that resonate particularly deeply for me as an Indigenous person, and in terms of how it aligns with our perspectives of health and wellness and how it promotes cultural safety and humility in practice, and it's very root cause based. So what I propose we do for our time together is I'll start by telling you a bit of my story so that you can understand how I became connected to functional medicine and why I am just so passionate about it. And then I'll switch into a few slides just to show you some of the tools that we use in functional medicine and why and how I think they work so effectively and why they're different than what we typically think of as an encounter in a standard Western family practice setting or conventional medicine. So I really could start the story any place, but I think where I'll start is from the end of my medical training. So I was thinking as I was driving to work today, I thought, oh my God, I started medical school 20 years ago. I don't feel that old. I did start medicine 20 years ago, so I've been doing this a while. I went into medicine when I was 21 years, I guess, because I just turned 40. So I went into medicine at 19, and I'm sharing that piece of information because I was young and I was quite naive. And I really thought that becoming a physician was going to be a way in which that I could support improving Indigenous health. I thought that I would be able to go and work in our communities and really make a positive difference. At the end of my 6 years of training, so 3 years of medical school and 3 years of residency, I was battered and bruised. It was a pretty challenging time. And the thing that had kept me going was this idea that when I got out into our communities, it would all be worth it, and that I would be able to make a difference. And sadly, when I did finally get out into practice and start doing locums, I had this devastating realization that all of the time and energy and resources and everything that I had invested in learning the Western medical model and learning how to be a good family doctor left me totally unequipped to support health and healing in our communities. Like, the Western medical toolkit was just a complete mismatch to what we actually needed to be healthy and well.
Right.
The other piece that was so devastating was realizing that because I was a part of that system and I was practicing that way of medicine, not only was I not helping people, I think there were times that I was actually creating harm. And so that was really, really a low point in my life. I didn't know what to do. And so I started to pray because I was lost and felt really hopeless and helpless. And by some miracle, I was given the opportunity to participate in a documentary series about Indigenous healing and Indigenous medicines. And for 8 months, I traveled with a film crew, and we went to every continent except Antarctica. And we met with the most generous knowledge keepers, medicine people, healers. And in that time, I was gifted with so many beautiful teachings, and I really came to understand myself better as an Indigenous person, as a Dene person, as a Métis person. And I also learned some very fundamental universal truths about health and wellness. And they were that we are one, we're all connected, that health and wellness is about balance in mind, body, and spirit. It's about gratitude, humility, respect, and ceremony. And these were all things that were really in stark contrast to the things that I had learned in medicine and the way that I had learned them.
Yeah.
And so I came back to Canada, and I practiced up in Dawson City for a little while, in Yukon, and I practiced in Edmonton. And I had these very significant shifts, I would say, in my own daily spiritual practice, and looking for ways to integrate ceremony and honor ceremony in my daily life. And so I felt very connected at that time in that way.
Mm-hmm.
But at the same time, there were some important teachings that I had received about balance and food as medicine that I wasn't really honoring or upholding. And so, especially when I was in Edmonton, I was leading a very high-paced lifestyle. I was working with the Faculty of Medicine, and there were lots of deadlines and a lot of different work pressures. And my boyfriend at the time, who's now my husband, he was a student. And so we lived kind of a very time pressured life, and we would eat food on the go, and I would have a coffee for breakfast and whatever they had at the cafeteria at lunch. And we might, get some takeout for dinner. We had 2 dogs, so I would run a few times a week. And so I kind of thought of myself as a fit person. But I wasn't really attending to all the different balanced parts of myself. And so in late 2009, I got sick with a really bad stomach flu. So I had fevers and chills and yeah, just awful, awful stomach flu. And it was right around the time of Christmas in 2009. And I had a trip planned to go back to Manitoba to visit my family and spend some time with them over the Christmas break.
Right.
And I was so sick that I had to cancel that trip. And so the new year came in, and I still, you know, I was going back to work, but I wasn't really back to my normal self. And then January 5th, 2010, I got a phone call from my mom that my mère was in the hospital. My grandma was in the hospital. They had found her unconscious. She'd had a massive GI bleed. She was bleeding in her stomach, and they'd taken her to the emergency department. And she was very, very sick. And my mère and I were very close. I was her only grandchild, and my mom was a single mom growing up, or when I was growing up. And so my mère was a really important person who helped to raise me. And so as I was getting madly dashing to pack my bags and get on the next flight to Winnipeg, I got the second call that my mère had passed away.
I'm sorry.
Thank you. And this isn't a story, I've told a lot of different parts of my story, but this isn't a story that I think that I've ever shared with such a large group. So I was crushed. I was so sad that I hadn't been able to go home, that I'd had to cancel this trip a week before. And so I then did travel back to Winnipeg. We prepared for her funeral, and on the day of her funeral, which was January 10th, I woke up with these bright red eyes. I had pink eye in both my eyes. I'd never seen anything like it. And I'd been practicing as a doctor for 10 years. I'd never seen anything like it. Thankfully, because it was a funeral, everyone just assumed that I'd been crying a lot, which I had, but I also had these glowing red eyes. I came back to Edmonton, and then on January 15th, I woke up and my knee had tripled in size. It was enormous. It was painful. It was red. It was piping hot. That was a Friday. By the end of that weekend, the same thing had happened with my left wrist and my left elbow. And then later that week, my pink, crazy, glowing eyes, the left eye had actually turned into a corneal ulcer, like a very severe corneal ulcer. So I actually couldn't see out of my left eye. So within the span of about 2 weeks, I'd gone from being a functional, what I consider to be healthy person, to being in a wheelchair and being blind out of one eye and having excruciating pain. I'd never had pain like that in my life, and being so tired. I'd never been that tired. And even now, I've got 2 little girls at home, so I've been through, you know, a newborn stage twice. Even that didn't compare to how tired I was. And so I was off work. I was disabled for 6 months. And it really floored me. I didn't see that coming. I didn't see kind of that major illness in my future. And it really kind of catalyzed me to try and get better. Like, I was ready to do anything because I'd never been that sick in my life, and I'd never been in that much pain. It was unbelievable. And so I saw Indigenous healers. I saw my rheumatologist. I had my family doctor. I was seeing a naturopath. I saw traditional Chinese doctors. And all of a sudden, I was really pushed to integrate all of those teachings that I'd gotten when I was traveling and learning about Indigenous medicines. And I had to integrate them with Western medicine to get better. And so one of the things that happened that was really significant is that I had to get over my resentment of Western medicine. So I was so mad at Western medicine and the pain that I had endured going through that training, the way that I'd seen our people treated when they went to the clinic and to hospital. And I just had a lot of bad feelings towards that medicine.
Yeah.
And so I had to take Western medicine to help myself heal. And so I started praying with it. And I realized that I needed to give it the same respect that I did to plant medicines and our indigenous medicines, and I needed to be grateful. And so I did that, and that helped. And then the other piece was I started learning about what's called anti-inflammatory diets. And so this idea that certain things that we eat turn our immune system on and cause inflammation and can cause us to get sick, and other foods do the opposite. So certain foods are medicine and other foods are not. And even though I'd heard that message every single place that I had traveled, I guess I sort of understood that to mean bush food, that bush food was medicine. And because I was living in Edmonton, and I was lucky enough that I have uncles that are hunters, and they would periodically come from Fort Nelson and bring us moose meat. The bulk of my diet, as I said before, was really just the standard American way of eating: Tim Hortons, McDonald's, whatever kind of takeout food was available.
Yeah.
And so I really learned about this food as medicine. And gradually over those 6 months, I recovered. I got over my arthritis. It was an autoimmune arthritis. I don't know if I talked about that. So my immune system had gotten confused and started attacking my joints and my eye tissue. So that all settled down. And what was amazing to me was there was a few key foods that I cut out of my diet as part of the anti-inflammatory diet. So I stopped eating gluten, I stopped eating dairy, and I stopped eating sugar, refined sugar, among a few other things. After I got better, I thought, oh, okay, I'm better now, so maybe I can eat these foods again. And I remember, I can't remember what it was that I ate, but I had some gluten, so in a baked product, a baked good of some description.
Right.
And I got a migraine, and it really was amazing to me that I'm somebody who had migraines since the time I was a toddler. My whole life had migraines. And for that time, when I got sick and went on the anti-inflammatory diet, I didn't have migraines. And it wasn't until I got one again that I thought, oh, wow, this is so strange. I've had these my whole life, and then I didn't, and now I've got them again. And so I did a little bit more experimenting and realized that, wow, when I eat gluten, I get migraines. When I don't eat gluten, I don't get migraines. And so it was really profound to me how food is medicine, and how all of these teachings that I've received from all these elders are absolutely true and can be applied even in our, more conventional urban settings that we live in now, where most of us don't have access to bush food as our sole way of eating.
Mm-hmm.
So that was part of my journey. And then I was on this new path of, embracing food as medicine and trying to be more balanced in mind, body, and spirit. And I have a friend who was on a similar journey, and she said, oh, I've got this book. She said, I think you'll love it. And it's called The Blood Sugar Solution by Mark Hyman, Dr. Mark Hyman. And I picked this book up, and he started talking about functional medicine. And like I said at the beginning, I was like, what is this functional medicine? I don't even know what that means. And I almost fell off my chair when I started reading this book, because here is this non-Indigenous, Western-trained family doctor from the United States who all of a sudden had a book written that was all of these same teachings that I had received from Indigenous healers around the world. So he was talking about food as medicine, and health is all about balance, and it's about relationships, and it's about restoring our natural physiology. Like he didn't use those words, but the way I read his book was the creator doesn't make mistakes. So we all have we all have the building blocks to be healthy and well and vibrant. What functional medicine does as an approach is gives us a way to explore what does somebody need more of to restore that natural vibrant health, and what do they need less of? What are the things that are interfering with their body's natural ability to be in balance and be harmonious? Right. So I started learning about this. I was practicing, I still had a family practice in an Indigenous community, so I was practicing with people. And I hadn't started the formal functional medicine training yet. So there's an Institute for Functional Medicine in the States. I was reading some of their books. I'd become a member, and I was scheduled to go and do their introductory module in September, in the fall. Right. Kind of in the springtime. And I had this young woman that came to see me at the clinic, and she had a story that was quite similar to mine. She had autoimmune condition that had started very suddenly, but her condition was much more severe than mine. Basically, every part of her body had, become inflamed. She'd been really sick. She'd been in the hospital. And I just got to meet her this one day, and she was a young woman with a couple of little kids, and I was talking to her and her mom, and I said, look, I don't know very much about this functional medicine stuff yet, but there's a doctor who works not very far from here who does this kind of medicine, and I think it might really be helpful to you, because she'd seen a number of different specialists, and they were doing a lot of treatments to try and minimize her symptoms, but they weren't really getting down to the root cause or figuring out why her immune system had started attacking all of her tissues in the first place. Right. So this woman and her mom were kind of interested in that. And I said, look, let's connect again next week. I'll go and talk to this doctor and find out if he can see you. And then we'll figure out with the administration how we can pay for that, because it's not covered, through medical services plan, but we'll find a way. So, so we went our ways. I got on the phone with this doctor. I said, look, I explained the situation. Would you be able to see this person? And he said, absolutely. I think there's probably a lot of teachings that the functional medicine model might be able to offer that might be helpful. I came back to work the next week. I was so excited. I went into the administrator's office to say, okay, look, we're a go. The community members on board, the functional medicine doctors on board. Now all we really need is to get the money, to make this all kind of come together, how we're going to fund this. Yeah. And the administrator looked at me and she said, Danielle, I'm so sorry to have to tell you this, but that young person got really sick on the weekend and she died. Wow. And all I could think about was this young woman who had this whole future ahead of her, her mom, her kids, and how our conventional system had been so unable and ill-equipped to help. And so that was in the springtime. And so I said, I can't wait. I can't wait till the fall. Like, I need to do this training now. And there was their next module was going to be a detoxification module, and it was happening in a couple months' time. So I changed all my tickets. I changed the course registration, and this first module was happening in Denver. And I have to tell you guys just one funny story, because it just still warms my heart. I'm the kind of person I like to pack for a trip the night before, but after having kids, like I'm not that, I just can't stay on top of things. So I was going to Denver for this first functional medicine training, and I hadn't packed the night before. So the morning of, I was putting things together, and I grabbed my passport and I opened it up, and it had expired 10 days before. And I was just beside myself. Like I had a total meltdown. I was filled with this sense of urgency, like I needed to learn this now. And now I wasn't going to be able to get there. So I had this huge meltdown. I closed my office door and I was just weeping, and I could hear my daughter was 2 at the time, and I could hear her talking to her dad being like, what's going on? Why is mommy, why is mommy so sad? And my husband was explaining it to a 2-year-old. So he's like, oh, well, mommy has, an important book that she needs to go on her trip, and she doesn't have the right book. And so then I heard this little knock on the door, this tiny 2-year-old knock. And so I opened the door, and my daughter was there carrying, I had a functional medicine textbook. And so she was carrying this big book that she'd found in the living room. She said, Mommy, do you need this book? Is this the book you need, Mama? And it totally melted my heart. So thankfully, my husband is like so much more rational than I am. And he's like, just go to the passport office, see what they'll do. And it was, again, a miracle by my standards. They got me a passport within an hour. I made my flight. I got to go to this training session, and I just haven't looked back. So at the training session, I learned more about the model. I learned how to apply it in practice. And so that's what I've been doing every day since I started with the Institute for Functional Medicine. So maybe at this point, if it's possible to have Cynthia bring up the slides, I'll just walk through, and I want to show you guys and explain a little bit more in detail what this actually is and how it works in practice, and why it's so different than the regular medicine.
That's great. Before we transition, just quickly, we have a question. I thought it seemed like a very quick question. I was hoping that you could address it. From Maxine says, she thanks you very much, such a powerful and compelling story. Does everyone who wants to use or to engage with functional medicine model need to give up gluten, dairy, and sugar? Like, are those cornerstones of it? Or
so no, and this is the really interesting part of functional medicine, and I'll dig into this a little bit more as we go through the slides, but an incredibly personalized model. And so no, there's certain people that they can eat gluten and dairy and sugar, and it's not an issue for their immune system. But what functional medicine, the approach, what it gives us is a way for people to apply that experimentation and that scientific method to their own experience. So what I do very routinely with my clients is we do what's called an elimination diet diagnostic test. And it's essentially a way for us to figure out which food is medicine for them and which food is a problem for them. So yeah, there's definitely no cookie cutter approach to it. That said, I will say that since I've been doing this functional medicine approach now for, I've been certified for how many, 5 years, I guess, 4 or 5 years. And so I've done the gluten elimination with hundreds of people, and actually my husband's the only person I know who has done the elimination and not felt any difference at all. And I'm not even sure, it might just be because he's so tired of me talking about gluten that he wanted to be the one person. But yeah, most people who I work with, when they take gluten out, they do feel better. And we can talk a little bit about why that is, specifically what it is about gluten that is a bit problematic.
Sure. Okay. Thanks very much. And thanks for your question, Maxine.
Yeah, so I just want to acknowledge before I go through the slides, that image in the background is by Christy Belcourt, and it's called Our Lives Are in the Land. And I've started using it as the background to my opening slides because it's so beautiful. And for me, it captures all of those teachings that I received so generously from the different knowledge holders and keepers that I've met over the years. And so I just want to honor Christy Belcourt's amazing gifts as an artist, but also it's a reminder to me to acknowledge our ancestors and the Indigenous knowledge keepers and healers who guide this way for us. So, as I've just mentioned, I've seen functional medicine transform people's health, including my own, and I really believe that functional medicine has the potential to restore wellness for us, specifically as Indigenous peoples, but I think everybody. But I think why it has the specific potential for us is that it aligns with our perspectives of health and wellness. It promotes cultural safety and humility in practice, and it addresses the root causes of illness. And so I'm going to walk through some of the background of functional medicine and why I believe these things. Next slide, please. So functional medicine is defined as a personalized, systems-oriented model that empowers patients and practitioners to achieve the highest expression of health by working in collaboration to address the underlying causes of disease. And if you do one more click, there's a picture of this sink that's overflowing. So one of the analogies that they offer at our training module to kind of contrast a conventional biomedical model with a functional medicine biomedical model is the idea of a sink that's overflowing. So if we imagine a client walking through the door, or even imagine myself walking through the door when I was so sick, it's like everything is out of whack and there's just so much dysfunction. And in a conventional Western approach, we're looking to clean up the mess. So we're trying to mop up the symptoms. We're trying to put Band-Aids on, and we're trying to just, at a very downstream level, clean up the mess. Yeah. Whereas a functional medicine practitioner walks into that same room, that same scenario, sitting across from that same client, and we're saying, okay, what turned the tap on in the first place? Is there a clog in the pipes? Like, what is it that's driving this mess? And let's deal with that, as opposed to just trying to mop up the mess. Mm-hmm. So that's how things are, philosophically different, I think, in the approaches. How that looks different in practice is that this model takes time. So in order to understand what turned the tap on for that person, where the plugs are, or the clogs are in the system, you need to sit across from somebody and you need to get to know their whole story. Mm-hmm. You need to understand their family history. You need to understand what their mom's pregnancy was like when they were growing, when they were developing in utero. You need to understand their childhood, their adolescence, you need to understand all those pieces to really get that systems-oriented and very personalized view of answering those two fundamental questions of what does this person need more of, and what do they need less of to restore their natural balance. Next slide, please. So functional medicine aligns with First Nations, Indigenous perspectives on health and wellness. So this is my belief. And if you go to the next slide, I'll show you why I believe this. So on the left-hand side of your screen, there is the First Nations Health Authority, First Nations perspective on health and wellness. So this is something, of course, that's been created in consultation with BC First Nations communities. For me, this resonates with the teachings that I received from Métis elders, from Welsh elders, from San Bushmen, Veda in Sri Lanka. These were all the same core teachings about the need for balance, mind, body, and spirit, and then that sense of interconnectedness and how all of these different factors influence our ability to be healthy and well. So to contrast that with the functional medicine tree, this is another systems view, another interconnected view of understanding how we create health or vice versa, ill health. And so in functional medicine at the roots, we think about all the different factors and things that people need in order to have a balanced mind, body, and spirit. And then the flip side of that is that those things can also cause imbalance if they're insufficient, or if there's issues there in terms of trauma or environmental pollutants.
Mm-hmm.
There's also, as you see, the mental, emotional, spiritual influences. And what I really appreciate about my training in functional medicine is that that is front and center. And I'll show you in one of our tools that comes later on, the functional medicine matrix. Mental, emotional, spiritual is right at the heart of what we do, but there is not a need to necessarily apply that Western scientific method to understand it.
Right.
Because of course that is where there's a great tension, right, between the ways that we are epistemologies, the way that we are in the world. So I appreciate that this model creates space for that and puts it in the middle, but it's not prescriptive, and it doesn't say, okay, we're the experts in spirit. It says, we know this is really important, and so we want to create a space for it and acknowledge it.
Okay.
So then as you have all of those different factors that feed up the tree, then you get the end result. So that's where, if things are out of balance, depending on your genetics, your diet, your environment, you might be somebody who develops asthma, or you might be somebody who develops diabetes, or you might be somebody who develops dementia. And so all of those expressions are individual and personalized, but they still dive down to those roots of their people who develop illnesses, chronic disease. It's as a result of not being bitten by a dementia bug or a diabetes bug, but it's actually preceded by many years, often decades, of insufficiencies in the roots of the tree, or imbalances, excesses of things like toxins or emotional traumas and stresses. So functional medicine promotes cultural safety and humility in practice. So I know that I'm speaking to a group that knows a lot about this already. So cultural safety, the way that I understand it, is determined by the person who's receiving a service, and it means that they feel that they've been respected, valued, and acknowledged who they are, and you know, the way that they are in the world. And cultural humility, again, for me, is something that relates to the practitioner, and that they've taken the time to humble themselves, to locate themselves, and to be open and acknowledge that there's other ways of being in the world than just what they bring to the table.
Right.
So next slide. We'll bring up two documents from the Institute for Functional Medicine. So on the left is Go To It, and it's a mnemonic that we use that structures our flow through a consultation, a functional medicine consultation. And I wanted to share this little snapshot with you because, again, there have been so many moments when I've been in these training sessions where I feel like I could just fall off my chair to see these, and no ill will intended, but to see these old white doctors up on stage giving these teachings that I've heard from so many amazing knowledge keepers. And so you'll see that the first G of the Go To It is gather, and it has two sub G's. And so the very first part of this encounter is gathering oneself. So we actually spend time in functional medicine training talking about how important it is to take a moment, to take a breath, to prepare ourselves to go in and receive with gratitude and humility somebody's story, to bear witness, and to position ourselves not as experts, but as we mentioned, collaborators, partners who will reflect back somebody's story and then offer whatever little teachings or knowledges that we've gained along the way that we think might be helpful to that person. So for me, that's so profoundly different than what I learned in my conventional practice. Just this idea of being mindful, and that who we are as practitioners and how we enter a room is really important. Mm-hmm. So that's the first G. And for me, that grounds us in that cultural humility piece. The next part, if you go, we can kind of skip over the O for now, because I'm going to show that to you in a moment. But if we go to the tell, this is my favorite part of a consultation, is when I've sat with somebody for, usually we're together for about an hour and a half. So I've listened to a lot of their story, and then we tell the story back to the person. So we have an opportunity to bear witness to their life story. We acknowledge their goals, identify antecedents, we call them. So we identify what has happened in their history, in their family's history, that kind of may have set them up for whatever illness they're facing. I'm thinking, like in my case, I learned after I got that really bad arthritis that I have certain genetic variant that makes my immune system more prone to getting confused. It's called HLA-B27. And it's something that runs in my family. So, you know, in my family history, that's something, if I was sitting with a patient, I'd say, okay, you had an aunt with this condition, your mom had this. And so that maybe indicates to us that you might have something in your genetics that makes your immune system a little more prone to getting confused. We also identify triggers. For a lot of people, there is a specific moment in time where they know things went sideways. And I mean, I was really clear when I shared my story with you guys. I said, Christmas 2009, I got a stomach flu. January 5th, 2010, my grandmother died. And January 15th, my body started to spontaneously combust, like I went on fire. So there's those triggers, and it's amazing how many people don't have the time or the space to really think about how all these things are connected, and how these emotional traumas have this really profound impact on our bodies and our physiological processes. Then we identify the mediators. So to Maxine's question about the gluten and dairy, those would be, for a number of people, would be mediators. They're things that are adding fuel to the fire. And so we talk about those as we go through the retelling of the story. And so for me, how this connects to cultural safety is that the way that these consultations are structured with that time. So you need to take an hour to an hour and a half. You need to hear somebody's whole life story, and you need to reflect it back to them to make sure that you've got it right. And so at the bottom of that, it says, at the bottom of the tell box, I'll read it for you. It says, ask the patient to join in correcting and amplifying the story, a context of true partnership. So to me, that is cultural safety. It's an opportunity and space for clients to say, yes, you got it right. That's me. That's my story. Or no, actually, this is a really important piece that you missed. We didn't talk about this. This aspect hasn't been retold yet. And so we really do get to create that together. On the right-hand side of your screen is the timeline. So this is, I use this all the time. And this is, it's usually I do it over 2 timelines because I can't fit everybody's life story. Sometimes for elders, it'll be 3 pages long, but we sit and we have it written out before us, and we just go and we say, okay, this is your family. This is what the genetics you probably came into the world with. This is what was happening for your mom when she was pregnant with you. And that's how we understand now that can change how your genetics get turned on and off. In functional medicine, one of the phrases that we use often is that genetics load the gun, but it's environment that pulls the trigger. And especially in the context of our communities that have been so negatively impacted by Canadian colonial practices and policies and assimilation and residential school, you know, there certainly our elders already know those teachings and know about how we carry things with us from our ancestors. And now there's Western science that's kind of coming to that conclusion as well, and showing us that yes, in fact, the traumas that our ancestors suffer, so the traumas that our parents, our grandparents, our great-grandparents suffer, get imprinted on our DNA and actually change the way that our DNA gets expressed, and can actually make us at a higher risk for things like depression or anxiety or diabetes. So it's all very interesting to me how it kind of is coming together. The next slide, please. Functional medicine addresses the root causes of illness, which leads to improved and lasting health. Next slide, please. This is the part of that makes me so excited and passionate about it, is because I worked in regular family practice for 10 years before I got into this, 10, 15 years. And I could literally count on one hand, less than that probably, the number of people that actually got better. And if they did, it was totally in spite of whatever I might have had to offer as a family doctor. And now working in this way and using these tools and this toolkit, I can't think of somebody who hasn't gotten better in some way when they apply this, this approach.
Right.
It's night and day, like totally night and day. And it makes sense, because when you're using an approach that's dealing with the root causes, people get better. So this is the functional medicine matrix. And when I was talking earlier about functional medicine, I actually didn't tell this story. I think it's important. Functional medicine developed in the 1990s, and so ironically or amazingly, I don't know, the term functional medicine got coined at a gathering that happened here on southern Vancouver Island on the unceded territories of the Lekwungen and Tsimshian peoples. There was a gathering of bench scientists and clinicians. I think it was like maybe 5 or 10 people who came together in Victoria, and they were trying to solve a problem. And the problem that they saw was that the conventional medical model developed in Europe in the 17th, 18th century, and it developed, or 19th century, developed to deal with two major things that were affecting people's health, which was infectious disease and trauma. And so it developed as an acute care model. It's really well designed to help correct those two things. But what this group of people in the early 90s was seeing was that the burden of illness now is not trauma and infectious disease, but it's actually chronic illness. It's things like diabetes, heart disease, strokes, cancers. And so they said, hey, this model from the 19th century is totally not designed to deal with the problems that we're facing. And so they tried to develop a model that would be better suited to what we're actually facing. And that's where they came up with this idea of functional medicine, that if we went back to the basics, to the physiology, and went back to, okay, what does a cell need in order to function optimally? What does a body need to do to function optimally? That they could create this new model. And this is what they developed. So what you see in front of you, as I said earlier, it's that core mental, emotional, spiritual. So they've made that a sacred space in the middle. But when I'm in practice, where I'm spending most of my time is actually in the periphery, which is very Western science, physiology, cells, molecules, DNA focused, still totally interesting, but different. So they came up with these 7 core functions that our body needs to do in order to be balanced. So assimilation is bringing things in from the outside world. So having a GI tract, a gut tract, that can bring food in and all those nutrients. Defense and repair is an immune system that's tolerant. So an immune system that makes the right calls. It doesn't start attacking its joint tissue or eye tissue. Energy, we need to be able to create energy at a cellular level, that's ATP, and the cells that do that are mitochondria. So we need to have mitochondria that are really robust and work well. I have to tell you, I learned this stuff in medical school 20 years ago, and it was like right over my head. I was really grateful that we didn't use it in our day-to-day practice because I was so confused by it. But when I went back to functional medicine, I was on the edge of my seat when they were talking about mitochondria. Like I was just, my mind was blown, like my hair was back. They were talking about the electron transport chain, which the first time around when I learned it in medical school, I was just so confused. This time it was like, oh my God, that makes so much sense. We need to have electron transport chains that work effectively to produce energy for our cells. So that means we need iron, we need carnitine, we need B vitamins. You know, like there's these things that we need just to have basic function. I'm sure you guys can tell I'm now getting like really ramped up and excited about it. So biotransformation and elimination is the detox area. We need to be able to get rid of toxins, and we now live in a world that is polluted beyond anything that our ancestors could have ever imagined. They've done studies looking at umbilical cord blood from infants in northern Quebec, Inuit infants from northern Quebec that are full of toxins. So, I mean, we need to, in this day and age, have detox systems that are well nourished and working well. Transport, we need to have blood vessels and lymphatic vessels that can move things around the body effectively. Communication, we need to have hormones that are signaling properly and their messages are getting received. One of the areas, of course, in our communities where we see a lot of dysfunction here is around blood sugar metabolism, and that has a lot to do with food as medicine and the fact that the patterns and ways that we eat now are so different from the way that our bodies evolved to eat. So we eat, if we think of our great-grandparents who were living on these lands pre-contact, their diets and the information that their food was sending to their cells was so different from the information that gets sent to our cells now from the food that we eat. Structural integrity has to do with everything from the integrity of a cell membrane all the way out to our muscles, our tendons, our joints. So when I'm listening to somebody's story and they're telling me, yeah, I've always had, problems with diarrhea and constipation. Okay, I go up to the assimilation node and I say, there's gut issues. And then they say, yeah, I've had eczema and asthma since I was a kid. Oh, okay, defense and repair. So their immune system's not happy. I have all over body aches. I've got brain fog. I have a hard time concentrating. I've been depressed. I've got headaches. Energy, mitochondria. Biotransformation and elimination, I mean, that can be everything. Detox comes out in just all over people not feeling well. Autoimmune disease. So as people are talking, I'm jotting things down in the matrix, and that's how we're getting to the root causes. So then we're looking at the lifestyle factors and we're thinking about nutrition. Okay, is this somebody who has adequate B vitamins and iron to fuel their detox systems. We're going to check that in their labs. Do they have enough vitamin D, which is this critical hormone that we use for all of these different nodes depend on vitamin D. And because of where we live, in the Pacific, or where I live, sorry, now in the Pacific Northwest, but in Canada in general, we don't get enough sunlight in the year to be able to produce enough vitamin D, and our food sources are not bush foods that actually are very high in vitamin D, so we're not eating bush foods. So everybody in BC who's not, or anybody in BC who's not taking vitamin D supplementation will be insufficient in vitamin D. I can't even order a vitamin D level for a client and get it covered by MSP because the government says that's a waste of money. Everybody in BC is going to be insufficient and everybody should be on supplementation. I'll let that sink in for a moment because most people are not taking vitamin D every day. And even people who are, in my practice, I ask people to do it anyway. And the people that can will pay the $65 to get that lab result. Even people who are supplementing at the recommended dose are insufficient. So that's how we're getting to the root causes, thinking about nutrition, sleep and relaxation, how important that is. You know, like people are burning the candle at both ends, and especially people like myself with autoimmune condition. We have studies that show us if you're sleeping less than 8 hours a night for somebody with an autoimmune condition, you're gonna get sick. You will get sick. So I don't want to talk too much more because I don't know, but I imagine people might have some questions. And I warned Cole at the beginning. I said, I'm so passionate about this. I'm so excited about it that I get like, I do a deep dive, and I don't know if people are with me or I lost you 3 slides ago. So hopefully we have a chance to get everybody caught up. We'll just go, I have one last slide. So again, functional medicine model can help restore wellness, I think, for all people, but specifically Indigenous peoples, because it aligns with our perspectives on health and wellness. It promotes cultural safety and humility in practice, and it addresses root causes of illness. And then the next click will just bring up a few calls to action. So in the next 6 to 12 months, you can implement functional medicine in your own life by honoring the teaching of food as medicine, or doing your best to kind of be mindful of that. You can learn more at ifm.org. That's who I did all my training with. That's who I'm certified through. They have some really excellent resources. There's a ton of books and blogs by functional medicine practitioners, and I can share some of the mentors that I have. And then the third, it would be to invite myself or other functional medicine practitioners to come and give some more detailed sessions on some of those specific functional medicine nodes. So to learn a little bit more about how to heal the gut, or support the immune system, or get the detox pathways open and functioning optimally. So, Masicho, Haichka, merci. Thank you so much for giving me this time this morning to talk about something that I feel so strongly about. And yeah, I'm happy to listen to comments or take any questions.
Great.
The floor is now yours.
Yeah, we have a few questions. I just wanted to say quickly, thanks very much, Danielle. That was fantastic. It was really illuminating to me. We spoke about functional medicine, I think, over a year ago now, and it's always just been something that's kind of in the back of my mind. You know what I mean? What is that? What does it look like really in practice? So we have a couple questions here. First from Ifni, could you perhaps discuss what functional medicine might look like in a first responder setting? Now, my personal take is that it doesn't apply as much in a first responder or an emergency setting, but it would be more of a long-term health and wellness management. Do you know what I mean? Like a long-term care. Is that a way you feel as well, or?
Yes, and thank you for that question, because that brings up something that I don't think I actually touched on explicitly, but that idea of two-eyed seeing. And so, and this is where I came to after I got so sick, was the idea that Western medicine and that conventional model still has some amazing gifts and insights to offer, and things that can really help us in kind of maintaining or restoring health. And so I think that's one of the perfect examples. Was it IFNI? That in a first responder scenario, so if I walk out and get hit by a bus, I want to go to the trauma center at VGH. I want to have all the Western medicine interventions done. I also want to have, you know, my family and my community, you know, praying and sending all of those wishes as well. But I think functional medicine, as you mentioned, Cole, I think really applies in that chronic illness phase and trying to get to the root causes of those chronic non-communicable diseases. And I think the interface would be, of course, that you might be a first responder to a situation where somebody's gotten so ill from all of those years and decades of imbalances that they're now in a critical care phase. And so I would see using those Western medicine modalities of intensive care, critical care interventions to get somebody through that, and then working with a functional medicine practitioner to really help get to the root causes. The one thing that I would say, I listen to a ton of functional medicine blogs and podcasts, and I know there's one woman in particular in the States whose son, very sadly, as I was just describing, was struck by a car, was in a trauma center. The trauma team gave her just a terrible prognosis, basically said, like, your son, like, don't even bother doing anything. He's not going to survive. Like, just let him go. And she was a mama bear, and she said no, and she fought. She had him transferred to a tertiary care center. And then she called on all her functional medicine colleagues and put a huge call out on Facebook and said, like, I need your help. I need anybody that has expertise, research in traumatic brain injury to help me out. And so what she did is she started doing very high dose fish oils, so omega-3s. And she did this totally, I guess, illegally. When the ICU nurse would leave the room, she would hook these things up to her son's IV and give him these huge doses of omega-3s. So I'm not endorsing this, by the way, I'm just telling this story. But her son recovered. Her son, and the team could not explain the rate of recovery of his brain injury. And it wasn't until after that she said, well, we were doing these other things. We were doing these other functional medicine interventions. So, so I think that it can be applied. It would be much in a first responder setting, but that's much more cutting edge. We don't have all of the studies to support it. And that's, of course, one of the areas where there's tension with with Western medicine is there's the evidence. They always want the evidence.
Yeah. So generally, rule of thumb, leave acute care to Western medicine, and then look to functional medicine to manage long-term chronic disease states or even just your general health and wellness. Cool. Okay. Thank you very much. So Jonina has a question, hoping you'll let us know where we can get this kind of care. Is it available in Vancouver? And she brings up a really important point about costs. In my experience, the kind of care that I need is not something I can always afford. And I know we were speaking earlier, you mentioned that it was kind of between you and the band, I believe, to get care for the patient. So could you maybe illuminate what are some of the costs of this, and is there any way that we can kind of get around that?
Yeah, so I didn't actually tell that part of my story, but when I started using this model in practice, I became so disheartened and, again, kind of helpless and hopeless because at that time I was working in an Indigenous community, and there were a lot of community members who simply didn't have the means to buy the nutrient dense foods that they needed to get well.
Yeah.
And there were just so many other factors. And so it actually started to feel unethical to go in and work with people and say, okay, here's the root causes of, the things that are driving your illness. Good luck with that. Like it really just didn't feel right. And so there was an opportunity for me to move into a public health position. And so now the bulk of my time is in government, working as the Indigenous health physician advisor to the provincial health officer. So I took that position because I really wanted to advocate for this type of care, because you've totally hit the nail on the head, Jolena. This care is not available in our provincially funded system. I was able to provide it in an Indigenous community under a pilot project. And then I went on maternity leave and my job shifted. So I'm no longer working there. And my clinical practice of functional medicine, I've had to move it into a private sector. So now people have to pay out of pocket in order to get this kind of care. So I only do clinical care a day a week, because the other 4 days of the week, I'm desperately trying to get the ear of Stephen Brown, the Deputy Minister of Health, the Minister of Health, anybody that will listen to me, Joe Gallagher, certainly at FNHA, to say, okay, we need to know about this model. We need to start integrating it, and we need to be able to fund it in the regular system. We also need to be able to fund the treatments. So fund and make those modifiable lifestyle factors like exercise and movement and relaxation and meditation and food security. We need to be addressing those issues as well and making them accessible. Nothing would make me want to pull my hair out more than be sitting with a community member who was on a trajectory to have diabetes or on a trajectory to have debilitating rheumatoid arthritis, and we could get their rheumatoid arthritis medications would be covered, medications that cost around $20,000 a year.
Yeah.
They'll cover that to kind of clean up the mess, right, to deal with something that was well established, as opposed to funding fish oil supplements and vitamin D was covered, but there was a number of other supplements that I could not get covered that were totally preventative. So I haven't painted a very optimistic picture yet, but I would say I think there is so much power. I didn't realize really how much power there is in community voice until I got into government. I kind of, from the community side, I thought like, oh, the government's just, they call all the shots and they make all the decisions. And that's partially true, but it's so influenced by politicians who are influenced by their constituents. So I think the more we can create this groundswell and that this demand, like that we need this kind of care, like we're not going to stand for anything less. I think that's what's really going to cause that that tipping and the domino effect.
Yeah, and it's such a, it's an interesting conversation that kind of snowballs into other things, you know, in terms of appropriately priced foods, and more importantly, appropriately priced healthy foods, and why those things are priced differently as opposed to, you know, like fast foods or cheap or those that are fried in all sorts of really nasty stuff. And then again, like you mentioned, going on into the supplements and the other, let's say, products, but just generally things that can kind of improve your health and wellness, or like gym memberships, for example, personal training that somebody may need after an injury in order to exercise appropriately in a way that's not dangerous for their body. All these sorts of things are additional health costs that we need to look at kind of implementing long term. So I totally agree with you.
I didn't answer part of Juliana's question, which was functional medicine practitioners. different areas. So if you go to that ifm.org website, they have a Find a Practitioner tab, and you can put in your address and they'll locate kind of the closest functional medicine practitioner. When I got certified in 2016, so 3 years ago I got certified, there were only 3 or 4 of us in the province that were certified, but this training has really taken off, and I haven't looked recently, but I'm sure there's lots more practitioners around the province now than there were even 3 years ago.
Yeah, we had a couple of people asking specific questions about where to find these practitioners. So for all of those questions, just like Danielle said, just visit that website. We'll have it linked afterwards in the YouTube video, as well as all the resources that we release after the session, if you need to find it again.
Yeah, and I would also, just on that point, I would direct people to Dr. Mark Hyman. Has 3 or 4 different books. They are really well written. They're very straightforward, and they're quite prescriptive in terms of how to apply a functional medicine approach in your own life without the guidance necessarily of a practitioner. So there are ways to get started on your own. I think having a practitioner is helpful because, you know, it's nuanced, it's complex, you want to get lab values and things, but there are ways to get started. So he's got the 10-day detox diet is a good one, and another one called Eat Fat, Get Thin, which it's an appealing title, you know?
Right on. And on that note, Dr. Mark Hyman, were there any other authors or book series or anything that you would suggest for those people that are trying to look into it, or just Dr. Hyman?
Yeah, so Dr. Hyman's excellent. A couple of other people that I really like, Amy Myers is a functional medicine doctor in Texas. Dr. John Klein is a functional medicine doctor actually in Nanaimo, who's written a couple of books that are really helpful around detoxification and detox protocols. His name's Chris Kresser. Is I'm not sure that he's even a practitioner, but he's a really knowledgeable person in this area of systems biology. Another friend of mine that I met at functional medicine training, Dallas Hartwig, is the author of The Whole 30, which is a great program. The book is called It Starts with Food, and he outlines a 30-day program that you can follow that, again, is all based on functional medicine principles. Mm-hmm. So yeah, Mark Hyman, Amy Myers, Chris Kresser, Dallas Hartwig, Mickey Trescott is another one. Oh, and Sarah Ballantyne. I can send you an email with all their links and names, and yeah, you can share that.
Yeah, that would be great. And we can share the resources with everybody that's registered here today, and make sure that you guys have the links and the resources necessary to start to pursue this on your own. So I'm just kind of going through the questions here. LJ and Eric, thank you very much for your questions. I think we kind of addressed those in terms of where to find functional medicine practitioners. And then Monica, again with the book list, we addressed that one as well. Thank you very much for your questions. And Jonita replied and said, thank you for acknowledging that people cannot always do what is recommended to them. I have felt dismissed by medical professionals who suggest things like supplements and treatments that I cannot afford. It gets disheartening at sometimes. It feels like they think of you as a patient that's not trying to get any better. So yeah, Jonita, absolutely.
Yeah, and I mean, that's really the piece, again, with this model, is having the time with people to figure out, okay, what can you do and what can't you do right now? And so the way that I found my practice evolved a bit when I was working, still applying functional medicine in Indigenous communities, was almost applying a bit of a harm reduction approach, right? So, no, okay, well, this would be kind of the Cadillac, like if you could do all the different things, you know, here's what you would do. But if that's not a possibility, okay, well, what are some of the things that you can even just stop doing or avoid? Or some of the things are, you know, even water, drinking more water is something that a lot of us just we don't have in our minds during the day. And that's huge. It makes such a big difference. I would love to share one story just because it popped into my head. And this woman, I just loved working with her. She came in to see me, and she was having this terrible belly pain. Like, it was just so bad. It had gotten to the point, it took her about 15 minutes to walk from her house to the clinic normally. And it was now taking her an hour because she had to stop so many times because her stomach was hurting so badly. So I started meeting her, and we were doing this functional medicine approach. And, you know, it was a number of visits of getting to know one another. And through that, I had talked a little bit about, we were talking a little bit about my functional medicine knowledge about refined sugars and how that can create inflammation and, you know, just some of those different pieces. And about the third or fourth visit, so she came in because of her belly pain, but of course she had a ton of other things going on as well. And so on the third or fourth visit, I was like, oh, you know, I haven't checked in with her about this belly pain. It's been a few visits. So I said, you know, when you first came to see me, it was because you were having this really awful belly pain. I was like, how is that going for you? And she goes, what? She goes, oh, that? She goes, oh, I just needed to stop drinking pop. She said, I stopped drinking pop and it went away. And I thought, oh my gosh, you know, because being in family practice for 10 years, you know, I told people many times about what healthy eating is, right? And I think everybody knows what healthy eating is. But just the fact that we had taken the time to hear her story and then kind of connect the dots about, well, this is the way that high sugar foods might be affecting you personally. Like, I don't know for sure, but this is one of the things that we know.
Yeah.
She was then she was motivated to make that change. Whereas before, you know, it didn't really not make sense in her mind, but it wasn't her story.
Yeah.
So anyway, I'm sharing that story, one, because I think it's kind of funny, but two, because I think even when people don't have the means to necessarily add things in, there's often a lot of things that we can switch out that can make a big difference.
Yeah, absolutely. That's really nice. Thank you to everyone that's active in the chat. It seems very active, and thank you for addressing questions amongst yourselves. That's really nice. Yeah, absolutely. Just change the country, and you should be able to find whatever practitioner that you're looking for. I think we'll wait for a few minutes. I'm going to put some Learning Circle plugs in. If you have any last questions for Dr. Behn-Smith, please do so in the chat box. Upcoming sessions we have. We'll have Carrie Ann Vanderhoop on next week to talk to us about weaving and how that's impacted her life. The following week we'll have a heart health session with Dr. Jeff Redding, and then medicinal cannabis is on the week after that. Yeah, so that's what we have upcoming, and I hope that you guys will register for those. I'm really excited for those sessions. We seem to have one last question from IFMI. I want to make sure I understand. For long-standing congenital conditions, okay, would the idea with functional medicine to be focused on improving quality of life and pain management, so diet would be a part of that? Another question, furthermore, if there are no others, can you speak more on connection between mindfulness, healing, and interdependence, and perhaps how autonomy/integrity of the self are involved in the frameworks you've laid out? Your talk today makes me think of the Wim Hof method, breathing meditation, mindfulness, cold therapy. Are you familiar with it? I found it monumental for chronic pain and post-trauma care. And from what I understand, it can be a game change for autoimmune disorders.
Great.
That's a long question. Thanks very much.
Yeah, thanks. I just figured out how to get the chat box up on my screen, so
there you
that
go.
helps me. That's great. Yeah, so absolutely, for congenital conditions that would be in that structural integrity node, obviously there's certain things that just that can't be changed about kind of mechanics or the way that structures are aligned. But then the focus would be on all those other nodes and optimizing their function so that you're reducing, usually the focus on reducing inflammation so that those areas aren't painful. Which is kind of the way that we do it. One of the things I think of is, disc prolapses and people with sciatica. So they might come to me with a lot of pain from those structural elements, but then when they do that elimination diet diagnostic test and they find different food sensitivities, and they take those out, or they reduce their toxin exposure by, you know, eating more like washing conventional fruits, or you know, there's other ways to do that, that their sciatic pain goes away. So it's not that the disc prolapse changes, but because they've quieted their systemic inflammation, it doesn't cause pain anymore. So that's how I see those things being connected. And then speaking about the connection between mindfulness, healing, interdependence. I'm not familiar specifically with the Wim Hof method, but I'm going to Google it when we get off, because it sounds really great. We spend a lot of time in our training modules looking at the most cutting edge Western science kind of discoveries around energy medicines, and how the mind, body, and spirit are all connected. When I'm there, I kind of think, oh, I'm so glad that you guys are coming on board with this now. And when I say you guys, I'm referring to my conventional Western colleagues, because of course, from the teachings of my elders, of course, all of those things are interconnected, and it's so important, you know, our thoughts and our minds, and that we be aligned and have good intentions all the way through. So yeah, so the kind of Western science stuff that we learn about would be things like entrainment, and how I don't know if it works across the across the webinar, but if I were physically in the room with Cole right now and sitting next to him at a conversational distance, our heart rate variability would become entrained. So we're starting to see with these Western science tools the things that we already intuitively know, and then making those shifts and those links in terms of how that impacts the rest of our systems and our physiologies. They've done some really interesting studies around looking at the Monday night football phenomenon in the States, where they have these spikes in heart attacks on Monday nights. And it's the excitement and the emotional intensity that people bring to watching football and, you know, their teams losing or winning, and just how those stress hormones can set off these cascades of inflammation and blood vessel effects that can actually cause heart attacks. Right. The reverse of that is true when we can even out our emotional responses using techniques like breathing, meditation, and mindfulness. We can actually even out our immune system response, our blood vessel health response. And so absolutely really important for people with autoimmune conditions, because those of us who have autoimmune conditions, we're basically people who are just more prone to inflammation. So we have to be extra cautious and deliberate in terms of calming our systems down.
Okay, great. Thank you very much for that response. And Tiffany, that was a wonderful question. Thank you all so much. I think it seems to be we don't have any other questions in the chat box. So I just wanted to take this opportunity to thank everybody for participating. And thank you, Dr. Behn-Smith, for coming on and chatting with us today, and kind of opening our eyes to what seems to be a really promising and wonderful practice.
Yes. Oh, it's my pleasure. Thank you so much for letting me share. And like I say, I'm happy to come back anytime in this venue, or if you're working in a community or a service organization or someplace where you think it might be helpful to talk more in depth around a certain node, whether it be around hormones or detox or immune, then I would be like really, really happy to chat more offline.
Awesome. Great. Okay, so thank you all very much for participating today, and I hope you have a wonderful day. Bye-bye.
Bye.